In this next section, we're going to talk about the other glands of the endocrine system. We're going to start with the thyroid and parathyroid glands. So the thyroid glands you've maybe heard of before, based on related to metabolism. And that's exactly what these hormones, the hormones do. So people say, oh, I have a high metabolism or a low metabolism, and it might be related to my thyroid gland and what's going on there. And that can all be true. So there are thyroid hormones that are produced. One is called T3, one's called T4, based on the number of iodine atoms that they have. Now, iodine is very important in the thyroid gland production of hormones. If you don't have iodine in your diet, your body is trying to produce these hormones, but they can't be completed, and they can't be released in the body, they can't do what they're supposed to do. So iodine is very important in the diet. Now, in the past, there were times where people were not getting enough iodine in their diet, and that's why nowadays, when you buy salt, for example, at the store, it's iodized salt. So they started adding iodine to salt so that people would get the iodine that they need. And it really is dependent on diet. So iodine is naturally found in many types of seafood. So people that live near the coast were eating seafood, they were getting the iodine they needed in seafood and things like seaweed and stuff like that. People that were landlocked didn't have as much access to iodine, and so what would happen is they would get what's called a goiter. So a goiter is basically just the enlargement of the thyroid gland. It happens in your neck, and what's happening here is your body's trying to produce thyroid glands. So it's being stimulated by the pituitary gland to produce these hormones, but there's no iodine available. And so basically the hormones they build up in the thyroid gland because they can't be released out and do their job. And it ends up becoming this large lump called a goiter. We don't see this as much anymore. It used to be more common like in the Midwest in the US, but we don't see this anymore really because of the adding of iodine to some of our foods and things like that. So that's why iodine is important, and it's because of these thyroid hormones. The other interesting thing about iodine is sometimes people can get thyroid tumors in their thyroid gland, and the way that scientists or doctors can see what's happening in the thyroid gland or even treat that thyroid gland is with radioactive iodine. Because if they have radioactive iodine, it goes directly to the thyroid gland. That's basically where all the iodine in our body goes. And so they can really target the thyroid gland specifically because of that use of iodine. So metabolism in the cells and in the body, that's what these hormones are doing. Okay, so what happens if you have hypothyroidism, so too little of the production? So this can be a problem, especially if you're young. It can cause slow development because your body's not metabolizing as it needs to. End up with short, stocky individuals. They're not growing like they're supposed to. If you have hypothyroidism. If you have hypothyroidism in adults, they call it myxedema, characterized by lethargy, weight gain, hair loss, slower pulse rate, lower body temperature, thick and puffy skin, all related to metabolism. So this is where, that weight gain, a lot of people say, oh yeah, my thyroid gland's not working correctly, I'm gaining weight because of that. And that could be true, that could be part of it. Hyperthyroidism, we call this Graves' disease. So they're producing too much thyroid hormone. Exophthalmic goiter can form, and this causes your eye sockets. So someone with Graves' disease, their eyes look like they're bulging because there is fluid building up behind the eyes, and it's actually literally pushing the eyeballs out in the sockets. So that can be a problem, obviously, and have to work on dealing with that. Some other symptoms include hyperactivity, anxiousness and irritability, insomnia. So what can happen is you just need to get rid of part of that thyroid gland. So you can destroy part of it either through surgery or through radioactive iodine, and hopefully get those levels back down to where they need to be. The other hormone that is produced by the thyroid gland is calcitonin. So we have the two thyroid hormones, we have calcitonin. This is related to calcium levels. So we talked about, we talked about this when we talked about the skeletal system, keeping the calcium levels in our blood in homeostasis. So when there's too much calcium in the blood. Then the thyroid gland releases calcitonin, which causes calcium to be deposited in the bones and reduces the activity of the osteoclasts. Remember, the osteoclasts are the ones that are breaking down the bone. Okay, so the calcitonin helps reduce the amount of calcium in the blood. This brings us to the parathyroid hormones. So the thyroid hormone has calcitonin and the two thyroid hormones. Parathyroid gland produces just one hormone. It's called the parathyroid hormone. We shorten this to PTH, and it works opposite to calcitonin. Okay, so let's go back. Calcitonin brings the level of calcium in the blood down. Parathyroid hormone causes the blood calcium level to rise. So these two are working in conjunction with each other. Negative feedback going on here. So if let's say that so if you have too much calcium in the blood, so you're out of homeostasis, thyroid gland releases calcitonin, the calcium is deposited in the bones, and the blood calcium level lowers, and you get back into homeostasis. On the other hand, if you have too little blood calcium, then that stimulates the parathyroid hormones to release PTH, which causes the bones to be broken down by these osteoclasts. It causes kidneys to reabsorb calcium, and it encourages the intestines to absorb calcium as well, and that causes the blood calcium level to rise back till it reaches homeostasis, and then the system shuts off. So this is negative feedback on one hand and negative feedback on the other. This is our thermostat working inside our body. PTH is very, very important. Parathyroid glands are very important. So it's interesting because it used to be, so sometimes people had to have their thyroid gland removed. And when they discovered these parathyroid glands, they were just these little pieces of tissue in the throat near the thyroid gland, and they didn't necessarily know what they were, so they just got rid of them. They'd sew up the patient, take the thyroid gland out, take out these little parathyroid hormones, parathyroid glands, sew the person back up, and their patient would pass away. And they realized, whoa, these parathyroid glands are very, very important. You can't live without a parathyroid gland. However, you don't necessarily have to have a certain number. As we pointed out, where's our little picture here? As we pointed out with the parathyroid gland, just want a picture of the parathyroid. I guess we'll go with this one. As you pointed out, generally people have more than one little parathyroid gland. Could be less than 4, could be more than 4. You don't necessarily need a certain number, you just need at least one in there. You've got to have something producing PTH. If you don't, then you're not going to be able to survive. So when they're doing surgery and things like that, they have to make sure that they leave at least a little bit of the parathyroid hormone and the parathyroid gland inside the patient's body. Okay, so those are the glands of the thyroid, the parathyroid glands. Here's a few things about the parathyroid hormone and calcitonin, how they're working in relation to each other. If you have too little calcium in the blood, we call this hypocalcemia. And then that's versus hypercalcemia, where you have high calcium levels in the blood. This can be caused by too much PTH being secreted, and this causes muscle weakness, abnormal heart rhythms, renal failure, coma, and even death. So hypercalcemia is very, very dangerous. Hypocalcemia can lead to tetany, which is where your muscles are contracting when you don't necessarily want them to, when there's not enough PTH. Alright, next we want to talk about the adrenal glands. Now the adrenal glands are found on top of the kidneys. They have two parts. They have the adrenal cortex and the adrenal medulla. And when you look at the adrenal gland, you can see this. So the cortex is on the outside, and the medulla is on the inside of the adrenal gland. And they produce different things. So let's look at this. So most of these are related to stress. Okay, so the adrenal medulla, which is the inner portion, it produces epinephrine and norepinephrine. Epinephrine you've probably heard of by a different name called adrenaline, and we all know what adrenaline does. That's our fight or flight reflex here. Norepinephrine is noradrenaline. So, if we're in trouble or something's going on, our hypothalamus sends out a signal using the ACTH, remember that hormone, the tropic hormone that's stimulating the adrenal gland. And so it stimulates, the hypothalamus sends a signal, stimulates the adrenal medulla. Oh, I think I just told you that wrong. Let me show you this thing here. Sorry, ACTH is for the cortex. The medulla is just stimulated by the hypothalamus itself. Sorry to mix that up there. Okay, so the adrenal medulla is stimulated by the hypothalamus itself, and what that does is it causes it to release epinephrine or norepinephrine out into the bloodstream, which causes that fight or flight response. All right, so that's a short-term dealing with stress in the short term. Causes heartbeat and blood pressure increase, blood glucose levels rise, muscles become energized, you're ready to deal with the problem. Now the long-term stress response comes from the adrenal cortex, and this is stimulated by the ACTH, which is released by the anterior pituitary gland to stimulate the cortex to release glucocorticoids and mineralocorticoids. Okay, and these are dealing with this long-term stress. So what happens with the glucocorticoids, they stimulate protein and fat metabolism instead of carbohydrate breakdown. They reduce inflammation and immune cells are suppressed. The mineralocorticoids cause sodium ions and water to be reabsorbed by the kidney, and blood volume and pressure increase. So these are long-term ways to deal with stress. They're good because they help us deal with stress, but they can have a negative overall effect on our body. So someone that's under stress for a long time can have some negative effects related to the constant release of these hormones. So then you want to get out of that stress, and your body, you don't want to continually be producing these hormones. So there's mineralocorticoids, we already talked about the glucocorticoids, you can see how they are related to that. And then also the adrenal cortex also produces sex hormones, testosterone and estrogen as well. So one of the common glucocorticoids that you've probably heard about is cortisol. And what it does is it raises blood glucose levels in at least two ways. Breakdown of muscle proteins, which that doesn't sound like a good thing over time, right? And then metabolism of fatty acids in other cells as well, instead of using glucose. Glucocorticoid therapy. So what we do sometimes is we use this glucocorticoid to help treat things that can be going wrong, because one of the things that, once again, glucocorticoids, what they do is they can they bring down the inflammation in the body and suppress the immune system. So we can use cortisone and rub that on our bodies to help reduce inflammation and relieve swelling and pain. Okay, but at the same time, it's also bringing down your immune system as well. So you gotta remember this. The cortisone is a steroid hormone. So these hormones that are produced in the adrenal cortex are steroid hormones. And so that's why you can rub the cortisone cream right on your body and it'll absorb right through, because it's a steroid hormone, can move right through the lipid membrane. Mineralocorticoids. Aldosterone is a huge one. And this one is dealing with the kidneys, and it's going to affect the amount of the sodium balance and the water balance in our body as well. You can read this little part here about renin and angiotensin and aldosterone. We'll talk about this when we talk more about blood pressure later on, and it's related to the sodium in the water and the pressure, the amount of fluid in our body, which affects blood pressure. Okay, so here you can see how these things are related to blood pressure and volume and how they're going to be affecting that. Okay, let's talk a little bit about the malfunction of the adrenal cortex. Addison's disease is hyposecretion of the adrenal cortex hormones. Hypo meaning not producing enough. So this can be caused by um, the release of excessive ACTH. It causes increased melanin production, which causes the skin to kind of take on this bronze color. People are susceptible to infection, and then very low blood pressure and possibly dehydration because you're not producing that aldosterone. Okay, so some pictures here, bronzing of the skin happening here in Addison's disease. The other side is the hypersecretion. We have something called Cushing's syndrome. And someone with Cushing's syndrome producing too much of these hormones, and so you get some physical characteristics related to that. Can lead to diabetes mellitus. Now this isn't diabetes insipidus. This is the glucose-related one, and often they have kind of this fat is deposited in the trunk. So they'll have like really skinny shoulders and skinny legs, but then have this layer of fat around their middle related to this situation here. And here you can see someone with Cushing's syndrome. Okay, and that's the adrenal gland. So now let's look at the pancreas. As I mentioned before, the pancreas has endocrine and exocrine function. Right now we're just going to focus on the endocrine function. When we look at digestive system, we'll talk about the exocrine function. So there's two types of so within the endocrine tissue, we have some different cells that are producing different types of hormones. We have alpha cells which secrete glucagon. We have beta cells that secrete insulin, and we have delta cells that secrete somatostatin. Now, the one you've probably heard before is insulin. Glucagon works in conjunction with insulin to maintain glucose levels inside the blood. So when we eat a meal, all that glucose gets broken down, or is broken down to glucose, put into our bloodstream. Now that glucose needs to get into our cells, because our cells need to use that to burn to produce energy. Now what happens here is insulin is released by the pancreas when we eat a meal, and the insulin is what triggers those cells to pull in that glucose. So if we don't have insulin, then the glucose is just flowing around in our blood, and our cells could be starving, even though there's glucose there, because they're not able to pull it into the cell. So that's what insulin does. So it reduces the glucose level inside our blood. Glucagon, on the other hand, does the opposite. So it increases the amount of glucose in the blood by breaking down stores of such things such as glycogen, which can then be broken down into glucose and released into our blood, so our cells can get that energy they need, maybe when we're not eating or something like that. So this is another example of negative feedback. So if we have too much glucose in the blood, then the pancreas releases insulin. Our cells are then able to pull in that glucose, and then our liver also pulls in glucose and stores it as glycogen. Then when our blood glucose levels go down, then we release glucagon, and then that allows us to start releasing glucose into the blood, either from the glycogen from the liver or from other areas, and then we're able to pull that into the cells and use that for the energy that they need. Somatostatin. So this prevents the release of insulin and glucagon, and prevents large swings of blood glucose levels, because we need that glucose level to remain very steady in our blood generally. There's spikes after we eat and things like that, and then we quickly bring it back down. Because if we have too much blood sugar, there are some negative consequences that are associated with that, and this is what we call diabetes mellitus. This is the other type of diabetes, the one we generally see when we say diabetes. This is what we're talking about. So diabetes can be caused by two things. There's type 1 and there's type 2. Let's start with type 2, because this is often called adult onset diabetes, although it's becoming more common in children. And this is also known as insulin resistant diabetes. So what's happening here is that for whatever reason, your body is no longer recognizing the insulin. So you have enough glucose, your body is still producing insulin, but for some reason the cells aren't using that to pull glucose into the cell. So often this happens in people that are overweight, and generally can be controlled with diet and exercise. And so that's type 2 diabetes. The type 1 diabetes is sometimes called juvenile diabetes, because this is caused by an individual that is not able to produce insulin. For some reason, the pancreas cells were destroyed. They could have been because of an autoimmune disorder. Sometimes viruses will kill the cells in the pancreas. There's different reasons, but for whatever reason, the pancreas is no longer producing insulin. So in this individual, they can still be eating a lot, have lots of glucose, but there's no insulin to pull that into the cells, so the cells can be starving. Generally, these people are going to be very, very thin because they're not able to get the glucose that they need, and they will have to take insulin in order to keep everything in balance. So symptoms of not having enough or having too much glucose in the blood, or not being able to pull that glucose in the cells, I guess having diabetes mellitus. You have hyperglycemia, too much glucose in the blood, and yet you're very, very hungry because your cells are not able to pull in that glucose. It's there, but they can't use it. Glucose will end up in the urine. So generally, we don't have glucose in the urine. Our body holds on to all of it. But in this case, there's just so much in the blood that it gets flushed out of the body. Polyuria, too much water loss to counteract that release of glucose. Polydipsia, extreme thirst. And ketonuria, ketones in the urine. And this is caused by the breakdown. This is a byproduct of the breakdown of fats. And so those end up in the urine, and so they see that and they recognize, oh, this person might have diabetes. And those are the two types again. If you don't treat diabetes mellitus, no matter if it's type 1 or type 2, it can lead to blindness. So that glucose in the blood can lead to blindness, kidney disease, circulatory disorders such as heart attack and stroke. So these are very dangerous complications. So we always have to deal with diabetes mellitus. Have to work with it. So those are the main glands in the endocrine system. We're going to look at a couple other things here just real quick. The testes and the ovaries. These are glands that produce sex hormones, the testosterone, which are androgens, and then estrogens and progesterone as well. And these are controlled by the hypothalamus and anterior pituitary gland. Androgens. The main one is testosterone. This is the main male hormone, although it's produced in females as well. Causes the growth of facial, axillary, and pubic hair, enlargements of the larynx and vocal cords, muscular strength. So people that take synthetic hormones, they're taking androgens in order to build up their body and things like that. Stimulates oil and sweat glands, and can cause baldness. So male pattern baldness is caused by genes, and then by the release of testosterone. Estrogen and progesterone, you probably have heard of these before. These cause the secondary sex characteristics in females, and also regulate the uterine cycle. When you learn about the reproductive system, we'll look at this in more detail, but I'm sure you've heard of these hormones before. These are also used in birth control pills as well. These are the hormones that are being released. The thymus gland. The thymus gland is related to the immune system. It's producing lymphocytes, which are white blood cells. It's more active when you're young, and then it starts to shrink as you get older. And then the pineal gland, we've talked about how it's producing melatonin, related to the circadian rhythms. And then we have this thing called prostaglandins. Okay, prostaglandins, these are hormones that are produced by cells that affect other cells nearby. So this allows cells to communicate with each other. For example, uterine contractions. So all the cells are separate, but they work together in uterine contractions due to prostaglandins. Gastric secretions in your intestines, lower blood pressure. So these are things that are all local hormones. We're still learning about these prostaglandins and how they all work. So how important are these things? These are very, very important, and these are the types of things we've talked about. So hormones, prostaglandins. We've already talked about neurotransmitters, which are chemicals which work in our body as well. There's one other type called a pheromone, which you may have heard about. These are generally sex hormones. These are released out into the air. You can't smell them, but our body can sense them and can be attracted to these pheromones. So the airborne chemicals that are produced by the body. Okay, the effects of aging. So as we get older, we sometimes get thyroid disorders. Thymus and pineal gland decrease in size. Often diabetes mellitus can happen, all related to aging. So there are effects on the endocrine system as we get older. Homeostasis. So the endocrine system and nervous system are working together, as we talked about before, to signal the body to regulate things in the body. So digestion, metabolism, blood pressure, calcium balance, response to internal environment, all of these things are affected by the endocrine system. So it's a very important system in our body. And that is it for the endocrine system.